Welcome everyone to this presentation on hypertension, a condition with significant implications for public health worldwide. This presentation is based on information from the renowned medical textbook, Davidson's Principles and Practice of Medicine. We will be covering everything from the basic definitions and causes of hypertension to its complications, treatment strategies, and management techniques. Hypertension is a condition where the blood pressure consistently remains higher than the normal range. It's defined as having a systolic pressure of 140 millimeters of mercury or higher, or a diastolic pressure of 90 millimeters of mercury or higher on multiple readings. It is often termed the silent killer as it may not show any symptoms, yet it can significantly increase the risk of cardiovascular disease, stroke, and kidney failure. Hypertension affects millions of people worldwide, and its management is crucial to reducing the burden of these associated diseases. There are two main types of hypertension: primary, essential, and secondary. Primary hypertension is the most common and does not have an identifiable cause. It is thought to result from a combination of genetic and environmental factors. Secondary hypertension, on the other hand, is due to identifiable conditions such as renal disease or endocrine disorders. We also discuss hypertensive crises. Hypertensive urgency refers to very high blood pressure without evidence of organ damage, whereas hypertensive emergency involves high BP with acute target organ damage, requiring immediate intervention. Secondary hypertension occurs due to underlying diseases or conditions. Renal causes, such as chronic kidney disease, are the most common secondary cause of hypertension. Endocrine disorders like hyperaldosteronism and pheochromocytoma can also raise blood pressure. Other factors, including medication use, such as oral contraceptives or NSAIDs, can contribute to hypertension. Identifying the secondary cause is crucial for proper management, as treating the underlying condition can normalize blood pressure. Hypertension occurs due to a combination of increased cardiac output and increased peripheral vascular resistance. Increased cardiac output can be due to higher blood volume or enhanced heart contractility. Increased vascular resistance is often the result of narrowing or stiffening of the blood vessels, which may occur due to arteriosclerosis or smooth muscle contraction in the arteries. Other important contributors include kidney dysfunction and neurohormonal factors like the renin-angiotensin-aldosterone system, RAAS, that elevate blood pressure. Hypertension is often asymptomatic, which is why regular blood pressure monitoring is important, especially in at-risk populations. When symptoms are present, they include headaches, dizziness, and blurred vision. Severe cases can result in organ damage, and patients may experience chest pain, shortness of breath, or stroke-like symptoms. In such cases, hypertension is considered a medical emergency. To diagnose hypertension, blood pressure must be measured multiple times, at different appointments, using a properly sized cuff and in a calm, relaxed state. It's essential to confirm the diagnosis by checking blood pressure on at least 2 separate occasions. Additional investigations may be necessary to rule out secondary causes, such as blood tests, urine analysis, and imaging studies. If left untreated, hypertension can cause significant damage to target organs. Cardiovascular complications include coronary artery disease, heart failure, and arrhythmias. Hypertension is also a leading cause of stroke and transient ischemic attacks, TIAs, as well as kidney failure and blindness due to retinopathy. By preventing or managing hypertension effectively, we can reduce the risks of these complications. Lifestyle changes are the cornerstone of managing hypertension. The DASH diet, which emphasizes low sodium and high potassium intake, is highly recommended. Regular physical activity helps lower blood pressure, and stress management is also crucial. Pharmacological treatment is often necessary and includes diuretics, ACE inhibitors, calcium channel blockers, and beta blockers. The choice of medication depends on the patient's specific health conditions. When treating hypertension, the goal is to lower blood pressure and prevent complications. The choice of medication depends on factors such as the patient's age, comorbidities, and risk factors. First-line treatments include thiazide diuretics and ACE inhibitors, often combined with other medications for better control. For patients with diabetes or kidney disease, ACE inhibitors or ARBs are often preferred. Combination therapy is commonly used to achieve optimal blood pressure control. Hypertension management requires regular follow-up visits to assess treatment efficacy and monitor for side effects. Home blood pressure monitoring can help patients stay engaged with their treatment plan and identify early changes in BP. It's important to also monitor for target organ damage, which may involve additional testing like echocardiograms or renal function tests. Hypertensive urgency and hypertensive emergency require different approaches. Hypertensive urgency is when BP is extremely high but without immediate organ damage. Treatment involves gradual BP reduction. In contrast, hypertensive emergencies require immediate, often intravenous treatment to lower BP rapidly and prevent further damage to organs like the heart, brain, and kidneys. Hypertension is a chronic condition, but with appropriate treatment and lifestyle changes, it can be managed successfully. The prognosis depends on how well the patient's blood pressure is controlled and whether there are any complications or comorbidities. Adherence to treatment is key to improving long-term outcomes and preventing the development of serious complications. To summarize, hypertension is a leading cause of cardiovascular and renal diseases, and it requires early detection and management. Treatment includes lifestyle changes and pharmacological therapies, with careful monitoring and regular follow-up to ensure optimal control. By controlling blood pressure, we can significantly reduce the risks of complications and improve patient quality of life. This presentation was based on the comprehensive information found in Davidson's Principles and Practice of Medicine and other relevant medical sources. For further reading and more in-depth understanding, I recommend referring to these references for additional details on hypertension diagnosis, treatment, and management. Subscribe for more educational videos.